With that, I'm going to turn it over to Ed. Ed, go
Well,
take it away.
thanks. Thank you, Alex. Good afternoon, everyone. Thank you for spending some of your Friday afternoon with us. And I want to say thank you, obviously, to Julian Canetti and the whole staff at the California Hispanic Chamber of Commerce for making this possible and for the trust that they've placed in us. I'm here in Chicago, Illinois, everyone, and we're waiting for 2 or 3 inches of snow. So if it's any comfort to you folks out in California, it's about 30 degrees in Chicago right now, and we're waiting for the snow. So I know there's some COVID lockdowns, but to the extent possible, enjoy your sunny climate. Today we're going to talk about a new health program that the California Hispanic Chambers of Commerce is endorsing. And what we're going to try to do today in about a half an hour is we're going to try to maybe get you to try to think about how you think about healthcare in a whole new way. What we're trying to do is we took the way that healthcare is provided and paid for and bought, and we tried to rethink it and break it down. And what we've discovered is that when you take the healthcare in the United States, we actually have a pretty decent delivery system. We have over 200,000 primary care doctors. We have over 6,000 hospitals. And so healthcare should be available to everyone in this country. But for the last 50 years, we've been stuck in the group health paradigm. And you know what, folks? It doesn't work. We've tried it all different ways. The group health paradigm doesn't work. And now we're in a situation where 2 or 3 companies, big, huge companies, control a large percent of the business. And every year, as employers, you're faced with the same old routine. You get your renewal notices, everybody has to reapply. It's an administrative burden, it's a financial burden, and you know what? It doesn't have to be. And thanks to the folks at the California Chamber, the Hispanic Chamber, excuse me, it doesn't have to be that way anymore. So what we did is we broke it down real simple into 2 categories. The first is what we call routine healthcare. That's your doctor office visits. That's your urgent care visits. That's your x-rays and labs. That's the kind of stuff that's done what we call outpatient, outside the hospital. And that's one category that we went out and got the best coverages for. And the second category, of course, is what we call the catastrophic. That's the stuff when you have, God forbid, you have a cancer, or you have a heart problem, or you have diabetes. You know, the high cost inpatient types of things. And so then we went and we got different coverage for that. And what's happened is the cost has gone way down. The benefits are better. I'm going to have Kate get into more detail with how this works. But please remember one thing, and I'm going to say it, and Kate's going to say it a few times today. This is not group coverage. It's individual coverage for people that belong to groups, so that each individual member, employee, employer is able to design their own healthcare that makes sense for them and their family, for them and their business. And we do that with no administrative burden on the employer, with less cost to everyone because there's less waste. It's not one size fits all. So with that, I'm going to turn it over to Kate, and she'll take you through some of the specifics. So Kate, with that, why don't you take it away?
Well, hello, everybody. As Ed mentioned, my name is Catherine Gutierrez-Schultz, and I am the Program Administrator for the CHCC Health Program. And today we are going to go ahead and review the program. It's a lot of information, so we're just going to go over the highlights of the program. And before we get started, remember, we are here for you to answer questions. After this webinar, anytime, you can also chat with us on our website, and we'll give you that information as well as we get through. Okay, so next slide. So how does a new CHCC healthcare program work for you? We're going to find out who is eligible, what the requirements are to enroll. We're also going to talk about the California individual mandate, as that is new this last year, January 2020. We're also going to look at what makes this program unique and see also how it works. We're going to compare the plans against marketplace plans, and then we're going to talk about a program that Ed is going to review with you called QSERA, something you can set it and forget it. We're also going to talk about on how to enroll as well and where we go to enroll. Okay, so next slide. So who is eligible to...
Kate, why don't you start out by telling us who's eligible to enroll in this program? I forgot I'm supposed to ask the questions, but there you go, Kate, you're on.
All right, so this program, it's unique benefit and it's only offered to the CHCC members and their affiliates. So no other chamber in the state of California has a program as affordable and unique as this program is. There is no minimum employee requirements either. So employers down to 1 can enroll in this plan. You can just simply offer it to your employees. You do not have to contribute. So this is a benefit that you're able to give to your employees and not have to contribute, which is a huge benefit. You can give this to part-time and seasonal employees as well. So remember, this is individual coverage and not group coverage. And year-round enrollment. You do not have a specific time that you have to enroll. This is year-round. So maybe in April you decide that you want to join this plan. You can go ahead and do so. Or maybe you just enrolled 12-1 with group insurance. Well, come 1/1, you can join this program. As long as you join by the 25th of any month, it'll be effective the 1st of that next month.
And what about the California mandate, Kate? Everybody in California has to have credible coverage. Well, certainly they've had it for 2020, now for 2021. Is this program compliant with that requirement?
Yes, it is, Ed. As of January 2020, the individual mandate went into effect for the state of California. And this program is minimum essential coverage, which is all you're required to have in the state of California. The minimum essential coverage is all employers are required to offer employees as well. And we'll get into those plan designs in a few moments.
Okay, but this is a lot more than minimal essential coverage. And so what I'm going to ask you to do now, Kate, is maybe take the folks through the component 1. At the beginning, I talked about 2 categories of healthcare. The first is the routine every day. You get a sore throat, you get a cold, you know, your child has. So why don't we go through how we cover those and pay for that type of medical services? Next slide.
Yes. Okay. Perfect. So the CHCC health program components. This is our essentials. The minimum essential coverage plan is our essentials program. So we have 3 to choose from in California. They all include doctor's office, specialist, urgent care, x-rays, and labs. There's no waiting period to go and see your doctor either. There's no deductible, so you're able to pay that low copay to go and see your doctor. And it's day 1. So if you join this program today and it starts January 1st and you need to use it, you can go January 1st for $15 or whichever plan you choose, but you're able to go and see your doctor. This also has low premiums. So again, this is our component 1, which is our minimum essential coverage plan, and we have low premiums. The program also includes a long list of additional coverages, which are prescriptions. In a couple of our plans that we have, you can get prescriptions for as low as $1, and the other is a $5 for generics. Then we have other programs for brand name prescriptions, and if you take a brand name, we can certainly help you find out what plan is best. We also have dental included, and dental is through Aetna, and it's a discount program. Then we have vision as well. And the vision is what I call a true vision plan, in that you have a set copay to see your provider. And then you also have an allowance, $50 to $70 off of your contacts or frames, whichever you have. There's also hearing included, so you get a discount towards hearing aids should you need that. There's also telemedicine, and the telemedicine is 24/7. You're able to call a doctor, and you can also have prescriptions sent in as well through that telemedicine. We also have telebehavioral health, which is a new benefit that began October 1st. And that is also 24/7. You can contact Behavioral Health Line and speak to anybody 24/7. We also have chiropractic care included, a consumer advocate, and wellness. And all of this is found on our health service hub.
And you mentioned there's 3 different plans to choose from, Kate. So each individual, once the employer makes it available, each individual employee can go and sign up for the plan that fits them best, right?
Absolutely, yes. So they can go and choose whichever plan that they want on our website. And like Ed said, there are 3 different ones to choose from. We then also have another option for upgrade, but you do not have to take the upgrade. You can take just the minimum essential coverage plan. And maybe as an employer, you want to go ahead and offer coverage and you do want to contribute. Well, maybe you only contribute to the minimum essential coverage plan, and that's okay too. So you give the option to your employees to be able to upgrade if they choose.
Okay, great. Okay, and then what about though for some people that may want to have a little bit more coverage for them and their family in case of a catastrophic health event or in case of some inpatient services that they may need? Do we have an option for them, for those folks?
Absolutely. We have our component 2, which is our
Next slide. Next slide, Alex. Thanks. There you go, Kate.
Okay, so here is our component 2, and it is for Zion Medical Health Share. It's for the high cost inpatient services. And Zion Health provides an organized way to share in one another's medical burdens. And medical cost sharing is not a new concept. It has been in place for over 20 years. And everyone is accepted. So it's not religious organization as you may have seen out there. This is a non-religious organization that does accept everyone. There are 3 different plans to choose from. They call them levels. There's no provider network as well. So you're able to go to anybody in the country in this plan. So maybe you did get a serious diagnosis like Ed mentioned, and maybe you want to go to the Mayo Clinic or
University of Chicago. Yay.
Yeah, somewhere. You're able to go. You're able to go anywhere to find that doctor that you want to see, and you're able to go anywhere in the country by choosing this plan. So you're not bound to any one network. And then this also offers worldwide coverage as well. So if you are in another country and you have an issue, you are able to use that as well. That country may, of course, make you pay before you leave, but Zion will help you get reimbursed on that. Okay, so then there are the 3 levels I do want to talk about though. There's a 1,000, a 2,500, and a 5,000, and they call them initial unshareable amounts. For short, we say IUA. So the IUA is what you initially pay should you have any kind of need, which is your illness or injury. And if you have a need, you pay that initial 1,000 or 2,500 or 5,000, and then Zion pays for the rest. So we'll give you an example there in a minute. Another point I do want to make is, again, this is upgrade. So not everybody has to take it. You're only required to have the minimum essential coverage plan, but to round out your coverage and make sure that you have that catastrophic as well, this is where component 2 comes into play.
And Kate, once somebody pays their initial unshareable amount, does Zion then pay 60% of the charges or 80%? What percent of the charges after you pay your initial unshareable amount what percentage does Zion then pay?
100%. So this is not a co-insurance plan. Once you meet that IUA that you've chosen, that's it. You don't pay for that need any longer. So for an example, you chose that 1,000 IUA and you got in a car accident and it's December today, and maybe this need extends through January. It's not a deductible that restarts calendar year. It's the same need, and for however long of the lifetime of that need, you're only paying that initial insurable amount of 1,000 if you chose that plan.
Beautiful. Okay, and then for a moment now, next slide, please, Alex. Thank you. We're just going to talk for a moment here about how we put this all together and you may have noticed on the left-hand side of this slide and on the couple of slides preceding this, there's a quote that says, "No administrative burden, no employer financial participation required." The reason that we can say that to you is because this is individual coverage, and we put it all on the Health Hub that there's a picture of there, so that once you opt in as the employer, your employees get to go to the hub, research which plan works for them, enroll online, and then afterwards they'll receive support and announcements of new benefits. So my point is that it's the Health Hub at www.chcchealth.net that brings this all together for us and takes away your burden administratively. Okay, so then next, Kate, right after I flip my name, 2 pages. Okay, so now, Kate, do me a favor and let's walk the folks through an example of how this can work for, you know, our Smith family that we have. So next slide, please, Alex.
Okay, so here we have how it works, and we have the Smith family here. The Smith family chose one of our best plans, the ChoiceCare Premium Essential Plan and the Upgrade-Zion 1000 plan. The company that Mr. Smith works for opted into the CHCC program, and so that's how he enrolled. And here he was playing outside with his son. His son gets injured. They take him to get x-rays done at the urgent care. Urgent care sends them to the primary care, and primary care sends them to a specialist, where then needs surgery and follow-up after that. So all of this, though, they're able to have using both our essential plan and our upgraded plan. And on the next slide, we'll show you what the cost breakdown is and what the Smith family actually ended up paying.
All right, so we have a family whose father, or breadwinner, mother, works for the XYZ company, which is a member of the California Hispanic Chamber of Commerce. And that employer opted in by filling out our one little one-page form, no financial obligation. And then the Smith family went to the Health Hub and they chose ChoiceCare and they upgraded it with a Zion initial insurable amount. And now next slide, and Kate's gonna show you how it worked for them to get the junior fixed up.
Yeah, so here for our ChoiceCare Premium plan, okay, this is, again, one of our better options that I think, anyhow. We have the trip to the urgent care. It's a $50. There's no deductible that needs to be met. You're just going to the urgent care for a $50 copay. X-rays, you know, you need x-rays done for junior, and that's another $50 copay. Now he has to visit the general practitioner, his primary care, and that's a $15 copay as well. And this actually, for a specialist, it says here 25, but we just recently changed that to 15 as well. So both your primary care and specialist are 15. And now we have your outpatient surgery because the specialist recommended surgery. So now we use the Zion part. And the Zion, you pay your first initial insurable amount of $1,000. And then after You see how therapy for 6 weeks is paid for 100% by Zion. Follow-up specialist appointments are all paid for by Zion, and the removal of the cast, any kind of follow-up that's needed after that pertaining to this injury is paid for by Zion. And maybe three of the people in the family all did the same thing at the same time. Just say that's it. They would have met their the most IUAs if they had a fourth need. If that family had a fourth need, it'd be paid for 100% by Zion. So if you did choose that 1,000 plan, basically your out-of-pocket max is 3,000 for a family for the year.
Okay. So in other words,
And
if I understand correctly, once they pay that IUA, and if they went to Stanford, or if they went to Mayo Clinic, all right, or if they went to University of Chicago, fine. Once they pay the 1,000 IUA, until Junior's leg is perfect again, they don't pay a dime. It's paid 100%.
That's right. That's right. And so
Now,
down here, we have the medical bills. So say they did not have health insurance in place. What we did was we found that it would be about $20,000 for all of that to happen for Junior. But since he does have health insurance and he does have the Upgrade-Zion plan, it's only costing $1,100 and actually $35 now, I think, because of the change in that specialist visit. So, but yeah, so a little bit cheaper in that regard, but definitely cheaper than going into a deductible plan or anything like that, which we will get into next.
well, let's talk about that for a minute. Next slide, please, Alex. Thank you. So this is a comparison side by side with the CHCC program, and we're going to use the ChoiceCare Premium with a Zion 1000 that's been upgraded with the Zion 1000, and we're going to compare it to a typical, I want to emphasize typical California Marketplace Gold plan. The reason that we chose the Gold plan is because that's the most, I guess there's Platinum plans too, but anyway, the Gold plan is the most expensive plan on the marketplace, and ChoiceCare Premium and with Zion 1000 is our most expensive plan. So it's apples to apples, all right? So Kate, why don't you walk the folks through what that looks like, that comparison?
Yes, so the typical Gold plan, another reason why I chose it was because the copays were as close as you could get to our copays. And this is a 2020 typical Gold plan as well. So there may be increases, of course, in copays, but for 2021, we don't have that up here. So
with the Marketplace plan, not with our plan.
Right, for the market, yes, for the marketplace plan. Yeah, so here it is against our plan. You can see the outpatient copays for your primary care, your specialist, and urgent care. You can see the difference there. For that typical Gold plan on the market, it's $30 to see your doctor, but in our plan, it's $15. And same with, again, the specialists are $15 in our plan as well. And in the typical Gold plan, it's $65 to see your specialist. So you can see the difference is down the line here. And if you chose that Zion upgraded plan and you had any inpatient needs, of course, after you meet your initial insurable amount, Zion pays 100%. Whereas on that Gold plan, you'll have some sort of copay or co-insurance that you're going to have to pay because they're not going to pay 100% because you still have your max out of pocket. And for an individual that's $8,200 this next year, and for a family it's like $16,000. So again, on our out-of-pocket max, it's only $3,000. If you needed a fourth need in 1 year, that's paid for 100% by Zion. And a need again is illness or injuries.
Okay, beautiful. All right. Well, that's great. Now we know a little bit about the benefits and how the benefits work. What about the cost of these plans? Can you explain that to the folks? Alex, next slide, please. Thank you.
So
there you go, Kate.
So here we have again, we took the typical Gold plan and we went to onto the marketplace and did a quote. And again, this is going to be based off of different your age, your income, and where you live, and what kind of plan you choose. So this, again, just a typical gold plan, but maybe it might be different in your area, okay, because it is all done by different regions in California. So here we have a single 26-year-old who wanted that typical gold plan. They do get a subsidy, but they're still paying, if you see, they're still paying a lot more, but taking that typical gold plan, getting a subsidy. If they wanted the full round out plan that we offer, it's $347. If that 26-year-old makes any more money, they're going to end up not being able to have any kind of subsidy. And again, that plan goes up. And our plan is $347 for that round out policy. And then for a family down there at the bottom, you have a 45-year-old, family that, 2 kids, and it's $2,000 difference. You can see right there. And that is tremendous what they'd be saving a month. So by the second month, they already have their IUAs paid for, saved, right? That they would be paying in a year, just in less than 2 months, really. And then the plan, the typical gold plan, has higher deductible or higher copays, right? So you're paying more monthly to see your doctor. You also have higher copays on a lot of the prescriptions. So there's a lot with the plan designs that are just tremendously different and make this comparison. And I can do a comparison in your area as well, so we can really get apples to apples on that for you. But just overall, being able to save $2,000 a month is tremendous.
And it's important to point out that the essentials from CHCC is only $195 and $385 a month. So that we're going to get you in to see the doctor that you want to see, okay? You're going to have lower copays. You're going to have day one coverage. You're going to have a much, believe me, folks, a much bigger network. And Kate can demonstrate that for you if you give her a call. Just twice, 3 times the size of the network. We're going to have nationwide coverage. You're going to have no network whatsoever for inpatient. You go anywhere you want with inpatient if you upgrade to the Zion, if you upgrade, okay? Plus, each of your employees, each individual will design the coverage that makes sense for them. You'll have no administrative burden. And that all means that we've cut way down on the waste that's involved with our current model of one-size-fits-all group healthcare. Everybody's happier, and it's just a much better situation for everybody. So that's great, Kate. Listen, that's the marketplace. What about the small group? We're going to go now to an employer, one of our clients, right, Kate? A small group policy. This company has 8 employees, right? Next slide, please, Alex. Thank you, sir.
Yeah, so I did a quote here over the summer. They're now one of our clients, but they were renewing August 1st, and their plan, of course, increased, and they reached out to me trying to see what else they could do. So I went ahead and compared their plan against our program, both in plan design and premium. And as I mentioned before, as I showed you before, I mean, our plan design really beats that gold anyhow. So you can see over here the difference in price. I can't see the very bottom. I apologize.
Okay, let me read it. Let me read it then. Okay, so our client, before they came over to us, was paying $126,000 a year in healthcare costs alone, premium cost alone. That doesn't include all the deductibles and all the max out of pockets. They were paying $126,000 for 8 employees. Now that Kate did the comparison for them and switched them over, they're saving $67,000 a year on just 8 employees. And those employees have better coverage. The one hole that we have, we got to bring it up, is if somebody has pre-existing. And 2 of these people in this company did have pre-existing. But because it's what is it, Kate? Some kind of waiver? What is it?
Yeah, so they were able to go ahead and keep their group plan and keep those 2 employees that wanted to stay on that group plan. And then they were able to get everybody else onto this program, okay? And
CHCC.
next year, if they should be recertified, because they're a small group, then they'll be able to show that they have valid waivers, because a valid waiver is individual insurance as well now.
Right. Okay. Great.
They'll be in good shape. So if this is you, if you have somebody who needs to stay on the group plan because they have a pre-existing that is going to exclude them from joining the program in full, then you can do this. You can have that one stay on that group plan and still be able to offer this to your employees. And if you are paying or contributing maybe 50% and they have families, this is going to be more cost effective for them, of course. So you're able to give just the opportunity if they do want to make the change and to save, monthly for themselves as well, then you're able to do that.
All right. And then the last comparison we're going to do here is with COBRA, because with COVID, as I don't like to bring up, it's a tough subject, but COVID has really affected a lot of small businesses very adversely. And I know a lot of you have had to lay off. You didn't want to, but you've had to lay off employees. You've been on reduced. So Kate did up a comparison. Next slide, please, Alex. That compares us to COBRA, and because this is individual, again, because this is individual coverage, this is something that you can do for your laid off employees. Kate, walk them through what it costs, why COBRA doesn't always work. That's always such a good solution.
Right. So I just want to point out though, just by opting into the program, you can offer this to those employees. So again, something that you're not contributing towards, you're just offering it to them. And it could be a lifeline right now because of the cost. COBRA is so expensive. When I left my agency last fall or last summer, it was $1,000 for myself and my children to take our COBRA plan. It was an HMO plan even, and it was a great plan. But I joined this program and I'm paying considerably less, $400 less to get the full coverage. And it's such a savings and such a lifeline to those employees that you've had to lay off, or maybe have to coming up with more of the lockdowns and stay-at-home orders that might be coming down.
And again, the prices that you see at the bottom of the screen there, that's for our upgraded products, right? So maybe a laid off employee might just do the essential and keep that doctor, be able to go in and see that doctor during these times, right?
Yes.
Right?
Yes.
Okay.
So,
now I'm going to, I'm sorry, Katie. Go
that's
ahead.
okay. No, I was just going to mention, because the, if you look at your bill, if you have group insurance currently and you look at your bill, the premium that you see there for the employee, it's then 2% more the employee does have to pay. And that's for that COBRA admin fees. So it's even a little bit more than you're even currently paying for those employees. So this is just a really good opportunity to give them better coverage and at an affordable price. And right now, I feel like that's most important than anything.
Okay. Now, I'm going to talk just for a minute. I'm going to steal the show, and we're going to keep this moving along here pretty quick. Next slide, Alex. But there is a brand new federal law that allows you to have all the benefits of this program we've just been talking to you about. We call it Set It and Forget It. It's a qualified small employer health reimbursement arrangement. We'll do the administration, we'll do everything, but what it allows you as the employer to do is set an amount that you're going to pay for healthcare. Each employee is able to spend that amount either on the CHCC Health Hub, or, as we talked about a moment ago, if they have a pre-existing, they can spend it on the marketplace, and we'll help them there as well. The most wonderful thing about this program is it gives the small businessman, and by that I mean 50 or less, the ability, the contribution is tax-free to both the employer and to the employees. So we're going to take all the waste out. We're going to give people the health care that they want and let them make some decisions. And it's all tax-free. We're using a bit of Uncle Sam's money. So if you contact Kate, and if we look forward to talking to you, but this is a program that I think that for small employers, it was just amended, so it became available here in 2020. So we encourage you. This is a wonderful thing. And again, you set it and forget it because we administer the entire program for you, right? Okay, next slide, Alex. Katie, real quick, how do people, once the employer opts in, how do their employees enroll?
Well, they go to the chcchealth.net, our website, our hub for our plans, and they can go ahead, they can compare plans, they can enroll right there online, they can chat with us as well. So if we have a chat box, a chat section, or you can just give us a call. But we're there for you. You can download the form as well, so you can do it online, but you can also download it and provide that to your employees as well if needed. And also telephonic assistance available too.
All righty, and of course, next slide, Alex. I'm sorry. Thank you, sir. And of course, Kate, they can get in touch with you. They can email us, right? I'm sorry, go ahead.
Yes, please give us a call. My phone number is there. It's 844-344-7330, extension 708. And then also we have another a line there that you can give us a call at, and email us anytime at info@apogee.health.solutions. And we also have our YouTube videos on our website. Very important, great videos. We have 2 of them on there. It gives another overview of what we just talked about. And then give us a call, please, anytime. We're here for you.
Right, and take a moment and watch those videos on CHCC Health. And I think that Alex mentioned that they're gonna, after all the things they've already done for us, that they recorded this and they're gonna make it available, and we'll have it up on the website. So next slide, Alex. Thanks to everybody. Isn't Kate great? Thank you, Kate. And thank you to all of you. And thanks to the CHCC. And if we can answer any questions on a Friday afternoon, we're happy to do so. But thanks, everyone.
Any questions?
Thank you guys so much for jumping in here. We do have some few questions here. So let's start up here from Antonio Angelis. Are we going to get a copy of this info via email? Antonio, we can absolutely get this over to you. But like Catherine said earlier, if you go to our website, chcchealth.com, that would be the best place to get all the information, one-stop shop. The next one we have from Amy is, what is an IUA?
Okay, yes. The IUA is our initial insurable amount for the Zion plans, and it's $1,000, $2,500, or $5,000. And you might think of it as a deductible because that's what you're used to right now, but it's not. You're only paying when you have a need, an illness or injury where you're going to the hospital, or some high cost outpatient hospital type thing. But it's going to be for an illness or injury. That's
right. So in other words, it's injury based, not calendar based. And what it does is, for any particular one illness or one injury, once you pay that initial unshareable amount, everything else until you're all better is paid for at 100%. Okay? And Alex, before we take another question, I did want to mention one more thing real quick. Michelle and Alex, and of course Julian, gave us a great suggestion, and so we followed up on it. And I just want to make this available to everybody. There is a COVID resource page available on the chcchealth.net website. What we did is we have a listing of all the testing sites by county, broken out by county. So that's another benefit to belonging to the CHCC. Anyway, I'm sorry. Next question. Sorry.
Sure. This one from Edward. If one of my employees has high blood pressure, will this be considered a pre-existing condition with your program?
You know what? The short answer is no, okay? But the most important thing is we make sure, we're very sensitive about the pre-existing. So we'd like to talk to, what's the gentleman's name? Edward? I know that name, but anyway. We'd like to talk to him and just make sure that we can tell him a definite yes or no before we would accept any enrollment. But the short answer is no. Typically, if it's well controlled by medication, that's an exception to the pre-existing.
Perfect. We have a question from Leo. You say you missed the beginning, but can you tell us about Apogee and what its role does it have in the healthcare program?
Oh, Apogee is just the company, Katie and my company, that we developed the health hub. We maintain it. We have a couple now of different hubs up around the country. Actually, we just signed the United States Veterans that we're kind of proud of. That one is going to be going live in probably by the end of January. So, but the CHCC, with the leadership of Julian Canetti and the great staff, they were the first ones, and there are maybe so. But Apogee is the company that developed it and maintains it and gets the benefits and puts them on the website and takes the enrollments.
Thank you, Ed. Next one from Stephanie. How are normal annual visits covered? And does this also cover natural health practitioners?
There you go, Kate.
So if you mean for preventative, of course, all your preventative is included. This is a minimum essential coverage plan. It's ACA compliant. It's compliant with everything. It has to include those preventative services. And then there's set copays to see your doctor. So you have a set copay of $15 to see your doctor. And again, huge networks. Personally, I have this plan. My son sees a specialist at Stanford, $15 to see his specialist at Stanford in this plan. So.
Okay, thank you, Katie. Next one from Leo. Can an individual enroll, or is it only available once an employer has enrolled?
The employer does not have to enroll. The employer opts in. And Kate, I'm going to let you just explain real quick what opt-in is.
Yeah, so if you're an employer who is just yourself, okay, we still need an opt-in form. And the opt-in form is to be compliant with the individual mandate that California has in place. So it's just for us to be compliant and that you're offering coverage to your employees. And if it's just yourself, again, we need you to opt in. And if you have more than one employee, again, just opt in, and then you're just offering it. You're not obligated. That's not that form is not obligated. It doesn't bind you to contribute or anything like that. It's just to go ahead and be able to offer it.
And it makes it possible for us to report to the California Department of Revenue, the California IRS, if you will, that these people have coverage that meets the California mandate. That's really all it is. And it takes, it's like half a sheet. There's nothing to it, so.
Next one, also from Leo. Can this presentation be in Spanish? Is there Spanish support? I can help answer this. We are putting together some Spanish material, I believe, Ed. And in terms of Spanish presentation is something we are looking forward to having.
We have the videos up on the Health Hub in Espanol now. I speak Spanish very slowly and very little. I know Kate is, but we do have the vids up in Spanish. The newest vid we just have in English, but the Espanol will be going up soon. Perfect. So yes.
Thank you. Another quick question: Is Health Hub like a healthcare carrier? Is what they're asking. I think they're talking about Apogee.
We're really more the platform. And then we went out and found, Kate and I and our partner Dave Baker, Mike Snyder, Gail Metzig, we went out and we found the carriers that we've actually, Kate doesn't know this yet. We got done this morning. We're pretty confident we're going to have, Kate, a fourth essential plan up on the board here right after the first of the year, and it's going to be a very competitively priced. So no, we're not the insurance company. We're the platform that goes out and gets the insurance companies and puts them on the platform for people to make up their minds which one fits their needs the best.
And then I'm the broker here in California for you guys.
Perfect.
And Kate is our local representative. So she's right there, willing to answer all your questions, and she lives among you. She's right there with you.
Really quick, I think we had a follow-up to one of our questions. Again, can an individual enroll if they're not working?
Well, that's a good question. Okay, was the employer, okay, when they were working, was their employer a member of the CHCC?
I believe they're asking if they're a member of the CHEC, but may not necessarily be an employer
Oh,
themselves.
Oh,
absolutely.
absolutely,
Oh,
absolutely.
yeah.
Yes.
Yeah.
Yeah, if you, the person, are a member and you are unemployed or perhaps starting a business, I believe is what they're asking.
That's the
Absolutely.
idea. Yeah.
That's-
Yeah.
yes,
That's why we emphasize today, this is individual coverage. This is not group. Throw the preconceptions you have with the hurdles and the hoops you got to jump through with those huge carriers when they shove you into a group policy. This is for individual small businessmen, young people just starting out with their own businesses. This is what we designed it for. And this is the reason that the CHCC allows us and gives us their trust, which is very important to us. They're the ones that make this possible for you people.
Perfect, perfect.
And you can have this plan up to age 64 as well, until you're Medicare eligible.
Really quick, Angelina asked if it covers vision and dental.
So we have vision and dental included in the minimum essential coverage plan. The dental is going to be more at a discount for your comprehensive needs. The vision, though, you're going to have your a $10 eye exam if it's outside of your preventative, of course, because that would be a zero copay. But your eye exam would be $10, and then if you needed your allowance for frames or lenses, then that's $50 to $70. Then we also have standalone dental and vision that you can purchase, aside from what's already included, and that's up to you.
Thank you. We have another one. Why is this so affordable? How is it possible for this to be at this affordable level? Ed, if you want to take that one.
Well, you know what? It's because we broke the categories of healthcare. Where we started from was first breaking out the different categories of healthcare. And when the providers that we went to realized that their level of risk would be defined so clearly. So in other words, for the essential plans, they don't worry too much because they're not going to pay for hospital. You know, they're going to give us the network discount, and then we have the advocate that will negotiate rates down, but they're not going to get hit with the $10,000, $20,000, $30,000 bill. On the other side, the upgrade people, they don't have to deal with the minutia of all the claims for routine medical care. So everybody's kind of doing what they do best, and it brings the waste and the cost. I mean, I wish I could tell you that we're all geniuses and we knew this was going to happen before we started, but to tell you the truth, we didn't. But you know what? It's really something to see the prices come down when you break out the healthcare into these two categories and then find coverage for each one. And then give people a choice about what works for them.
Really quick from Edward, great material. Is Apogee's first experience in health offerings? They're asking more about Apogee on that one. And I don't know if you want to
you want to take this, give a little bit about your experience, and then I'll tell them about the Chicago lawyer.
Yeah, so I've been a health insurance agent in California for over 10 years. I've done individual, group, retiree insurance, and about just over a year and a half now almost is when I joined Apogee. And when I looked at what they had to offer, honestly, I can't go back and sell traditional market insurance without an actual purpose of if somebody has a pre-existing need, because we took out all of the stuff. You're not going to the hospital, right? So in the MEC plans, you have the cost controlled. And so that's why we're able to keep that affordable. And then you have that Zion for that extra bit. So that's just the traditional market insurance, they just keep increasing. And so we were just able to find an alternative way to help out the members.
And I'm a recovering labor lawyer. I represented an international union for many years, and I got tired of fighting and beating my head against the brick wall because I knew we could bring these costs down. And I always saw that as a great organizing tool for the union. So I quit the unions and we started this company. So yes, the CHCC is our first foray into it. and it's worked out so great. And like I said, we just signed the veterans. We have a union in New York that was going to go out and do the Lyft and the Uber drivers, but then COVID, we have 2 or 3 others. I'm sorry, I just can't pull them up right now. But yes, CHCC is our first one.
Perfect. Next one from Stephanie. Can you please put up the link to the website to sign up on in the chat? I can also put it up here on the presentation here, the link to the website. But yeah, and this will be available. We'll be pushing out a lot of this information, the links and stuff to everybody after the webinar. So you'll be getting this stuff as well. Next one from Antonio. Can we use this plan to go to a Kaiser facility?
No.
I don't know about that. No. Kaiser is a closed shop. You can't use a Blue Cross Blue Shield policy that I know of. Now, we don't have Kaiser in Chicago. Kate, maybe it's better for you to handle.
Yeah, no, Kaiser is their own beast, their own, unit. They will not accept any other insurance at Kaiser.
Right, yeah.
Okay, next one from Amy.
Why do you want to go to Kaiser when you can go to Stanford?
The next one is from Amy. Is there a directory of local resources / network for the services offered under each of the plans we can access? For example, who are the telebehavioral health providers?
Yeah. Yes. So on our website, you'll be able to find that information. And then after enrolling, you'll have your own portal, your own specific portal for yourself, and that will include all of this information as well. You can find providers for the dental plan, the vision, as well as behavioral health, all right there on your own personal portal once you enroll too.
And the idea of the website, of the web hub, is so that you can try before you buy. So if you have a particular doctor that you want to see participates, you have a particular dentist, you can go on the website, you can get more information about each particular benefit, and you can do a network check, or you can call Kate or one of our folks here in Chicago, and we'll help you and go through it with you. But the information's there on the web hub, yes.
Yes, and I'm available. I'm available to help you anytime.
Okay, I think with that is our last question. So with that, I want to thank you all for joining us today. I know a Friday afternoon is a little rough, but we thank you all. We had a very great group here today. A lot of good questions, a lot of good information. I'm going to leave this up right here for another minute or so here. Thank you, Catherine. Thank you, Ed. Any last parting words from either of you guys?
Yeah. Thank you, Alex. Thank you, Michelle. Thank you, Julian. And thanks to all the people that took some time out of their Friday afternoon. This was great. Thank you, Kate.
Thank you, everyone.
Awesome. Well, thank you all. With that, we'll close out for the day. Everybody have a great weekend and happy holidays.
Happy holiday. Great.
You too.
Thank you. Bye-bye.
Bye.